spectrum disorder is a neurodevelopment condition which affects a person's social and communication skills, accompanied by some repetitive behaviors and very strong sensory preferences or sensory sensitivities. It is a spectrum disorder, that means every individual and every child with autism is unique and they may have different challenges and different abilities. What are the early signs of autism which can be detected in early childhood? Autism can be even diagnosed as early as before the second birthday of the child. So what are those early signs of red flags which we need to identify? So there may be some challenges in social development where child may have poor eye contact. If a child does not respond to his name, if you call a child and child may have delayed or poor name response call. Child may be too much busy in his own play and he may have very strong preference to the objects than to the people. So as a development, we know that a child will have more preference or social connection with the human, with the people. But if you see a child who is more engrossed in his play, in solitary play, and does not respond in the reciprocal conversation or play with adult, that's again a very important early detector or a marker. Children with autism can also show some signs in delayed in their communication skills. So, in typical development, by 12 to 15 months, child starts communicating their needs. They share their joy with you by using lot of gestures and by using verbal expressions. So, children with autism, they may have delayed in their non-verbal and verbal communication. So as we know, by the typical development, by 12 months to 15 months, child starts pointing on to objects if they ask to, or if they want to show you something. But a child with autism or who have early signs to autism, they may fail to point to the objects. They may just hold your hands as a tool if they want something. If you show them something, they may fail to join their attention to that object, and which limits their communication. Along with that, there can be a lot of sensory processing issues which can happen in children with autism. And due to that, they may have a very strong sensory preferences. There are few children who may be too sensitive to sounds or bright lights. A child who may just cover his ear because he doesn't like the sound of very normal objects or play activities. Along with the language, social and communication issues, child with autism may also have varying degree of sensory processing issues. These sensory processing issues again can vary from person to person. There may be few children who may be too sensitive to few of the sensations, like they may be too sensitive to sounds, where they may cover their ear with the loud noise, or they may not be comfortable with bright lights. Child may not be comfortable in touching onto many objects or many things, or doesn't like to be messy. On contrary to that, there may be few children who may be unresponsive to few of the sensations, where child would like to put lot of things in the mouth. Child can have mouthing, or child would like to touch a lot of things. They can be very messy in their play. Or child may be too much on the go. Child may not stand or sit still in a place. They may have poor sitting tolerance, which affects their attention span and abilities to focus onto some meaningful activities, which again affects child's interaction with the environment. There may be few children with autism, they may be very repetitive in their play. They may just like to line up the toys or stack onto things. They may love to play with the parts of the objects, like a child who may be too fascinated with the moving objects. They may love to look at the fan, they may love to spin onto the wheels, and they may be too repetitive in their play, and they may have lack of flexibility into other meaningful play. So these comes under the repetitive play, or they may be too fixed with their routines. There are many myths about autism, that children with autism cannot learn, or children with autism has low cognitive skills, which is not true. A child with autism can have very high cognitive skills, and many a times they are very good visual learners. They can be very good in music and art. They are very good with gadgets. So what to do when you know that child has autism? Development therapies like social and communication therapy, which helps the child to improve onto language and social communication skills, where child learns to make connections, engagement with people, and learns to communicate by using a lot of gestures and meaningful words. Occupational therapy also helps a lot in children in sensory integration, depending on the sensory challenges which child is having. Along with these therapies, it's very important to provide a very positive environment in the home by the family, and inclusive education is very important for our children, so that our children get equal opportunities, equal rights to learn in the school environment, so that no child is left behind. So autism is not a disability, it is a different ability. Children with autism can do wonders, yes, provided the right support, guidance, and inclusion by the society.